Spotlight on Eating Disorders, a presentation by Corey Ricks, Solomon Ricks, Jared Scott, Shanice Simon, and Tyler Slade. Anorexia nervosa, perhaps the most recognizable eating disorder, is an emotional disorder that can cause a loss of appetite. It eventually reaches a point where an individual becomes obsessed with losing weight by refusing to eat. If not treated, anorexia can become a life-threatening disorder. Most people assume that only supermodels and young females can be affected by anorexia. This assumption is far from the truth. Anorexia can affect anyone regardless of financial status, occupation, or sex. Although the cause isn't clearly known, factors that influence the disorder include psychological, or a drive for physical perfection, environmental, pressure from peers or what's considered societal norms, and biological, genetic changes causing some to be more vulnerable to anorexia. Some symptoms of anorexia include inadequate food intake leading to weight loss and an intense fear of weight gain. The disorder causes one's self-esteem to be overly related to their body image. Oftentimes, it leads to binge eating, followed by purging, or regurgitating whatever has been eaten. Anorexia has many warning signs that are often ignored or overlooked by those close to the individual suffering from the disorder. Some of the signs include, but aren't limited to, complaining of being or feeling fat, making excuses not to eat, and repeatedly weighing oneself. There are multiple ways of treating anorexia nervosa. Depending on the severity of the disorder, these treatments can be as simple as finding a weight management plan to restore a healthy weight, or as severe as hospitalization for those whose overall health is seriously impacted. Another eating disorder, bulimia nervosa, is very similar to anorexia nervosa in terms of influential factors: the psychological drive for perfection, the potential impact of genetic changes making an individual more susceptible to the disorder, and the pressures on individuals from their peers as well as society. Bulimia has multiple warning signs as well. One of the most commonly noticed warning signs, however, is forcing oneself to vomit after eating meals. This is usually coupled with excessive exercising to burn off whatever calories were consumed on a particular day. Similar to anorexia, bulimia can be treated in ways as simple as educating oneself about nutrition and developing a healthy nutrition plan, or as severe as medications and psychotherapy. Hospitalization would be necessary for those suffering overall health complications as a result of the disorder. Another eating disorder is binge eating, commonly referred to as compulsive overeating. Essentially, one consumes excessive amounts of food while feeling unable to stop. As a result, excessive weight gain occurs. Some symptoms of binge eating disorder are continuously eating even when the individual is no longer hungry, stockpiling food for later consumption, and deciding the only way to alleviate stress or anxiety is by eating. Rather than acknowledge their feelings, they eat large amounts of food and they become addicted to the behavior because it gives them relief from their feelings. Typical binge foods include sweets and high-fat snacks like chips, but if junk food is not handy, binge eaters might eat large quantities of starchy foods. Binge eating is often a learned response to stress or conflict passed down from one generation to the next. Binge eaters usually require therapy to help identify their long-buried emotions. Therapists discourage patients from trying to lose weight initially because attempting to restrict food intake can backfire by creating anxiety and provoking a binge. Long-term support like Overeaters Anonymous help binge eaters from relapsing. Many patients benefit from antidepressant medication because the drugs reduce the urge to binge, most likely by altering the brain's serotonin level. Body dysmorphic disorder is a type of chronic mental illness in which an individual can't stop thinking about a flaw in their appearance. This flaw can be either minor or imagined altogether. Examples include blemishes on the skin, thinning hair or facial features, nose too big, thick or thin lips, big ears, just to name a few. The perceived flaw could be small or insignificant, but to an individual with body dysmorphic disorder, their appearance seems so shameful that they don't want to be seen by anyone. Although the exact cause of body dysmorphic disorder is still unclear, experts believe it is related to problems with one of the brain's chemical neurotransmitters. As a result, body dysmorphic disorder often coexists with other mental conditions, such as obsessive compulsive disorder, major depression, delusions, and social phobia. Roughly 2 to 7% of patients who undergo plastic surgery have body dysmorphic disorder and are often dissatisfied with the results of their surgery. Body dysmorphic disorder affects roughly 1 to 2% of the general population. However, it frequently goes undiagnosed. Sufferers are ashamed of their problem and fail to report it to their physicians. Some signs and symptoms of body dysmorphic disorder include preoccupation with physical appearance, similar to anorexia and bulimia. The belief that one has an abnormality that makes them ugly, and either frequently looking in the mirror or avoiding mirrors altogether. Psychiatric treatment of body dysmorphic disorder include medication and cognitive behavior therapy. Medications that have been used successfully to treat body dysmorphic disorder are the SSRI class of antidepressant medications: Celexa, Lexapro, Prozac, and Zoloft, just to name a few. Cognitive behavior therapy helps those with body dysmorphic disorder by helping them to resist their behavior, such as mirror checking. It also helps them to face situations that they habitually avoid, such as their aversions to social situations. In the end, cognitive behavior therapy helps the individual develop a more realistic view of their appearance. Another eating disorder is night eating syndrome, or NES. When an individual grazes through the evening or finds themselves plotting midnight refrigerator raids or wakes at night to eat, they may have NES. NES is different from binge eating in that the individual does not necessarily overeat, nor do they eat in an out of control manner. Basically, they just consume the majority of their calories at night. Similar to body dysmorphic disorder, the causes for NES are not fully understood. The disorder can result from a combination of biologic, genetic, and emotional factors. Several hormonal imbalances among NES sufferers have been noted, such as low levels of both melatonin, a sleep-inducing hormone, and leptin, an appetite-suppressing hormone. Cortisol, the stress hormone, appears higher at night in night eaters. Perhaps the elevation of cortisol at night wakes the individual suffering from NES and they head for the kitchen. Stress, depression, and anxiety commonly affect mood among those with the condition. Typically, an individual with this disorder has a tendency to eat the majority of their calories either during and or after the evening meal. They wake up at least once a night to find something to eat, usually a high-carb snack. They feel anxiety or guilt while eating. They lack an appetite in the morning, postponing breakfast for hours, and they persist in this behavior for at least 3 months. Although NES only affects a small percentage of the population, roughly 1 to 2%, it affects approximately 25% of people classified as obese. NES involves a disturbed food intake circadian rhythm, the physical, mental, and behavioral changes that follow a roughly 24-hour cycle, responding primarily to light and darkness. Sufferers of this disorder may be out of sync by as much as 4 to 5 hours with an individual's normal sleep pattern. NES is possibly the first clinical disorder to manifest differing circadian rhythms of two biological systems, eating and sleeping. NES sufferers typically have a heavy preference for snacks rich in carbohydrates. Carbohydrates have been proven to trigger the brain to produce feel-good neurochemicals, which suggests that night eating may be an attempt by individual sufferers to self-medicate any mood problems they experience. Possible treatments for night eating syndrome involve the participation of either a dietitian or a psychiatrist-psychologist. Dietitians can help to develop meal plans that distributes an individual's daily caloric intake more evenly throughout the day, helping to prevent caloric loading in the evening. Similar to body dysmorphic disorder, NES sufferers can be treated using cognitive behavior therapy, or they can participate in stress reduction programs, since, as stated earlier, stress, depression, and anxiety commonly affect mood among those with the condition. There is a myth that eating disorders are a female disease, but that is not true. Though less common, males suffer from eating disorders as well. In activities such as wrestling, swimming, and running, there are pressures of leanness that can trigger anorexic behavior. These eating disorders develop during adolescence in women as well as men. And since most people are conditioned to view eating disorders as a female problem, disorders such as binge eating are often unnoticed in men. The female athlete triad is a trio of medical problems that affect many female athletes who go too far to be thin. Sports-related eating disorders are known as anorexia athletica, which initiates the female athlete triad. It is an interrelationship between disordered eating, amenorrhea, and osteoporosis. The first leg of the female athlete triad is disordered eating. In an attempt to lose weight, the athlete develops harmful eating patterns resulting in an energy deficiency. The loss of body fat results in low levels of estrogen and irregular menstrual cycles. This condition is known as amenorrhea, which can lead to osteoporosis. Osteoporosis is a disease developed from the loss of bone mineral density that can start from the spine and spread. Replacement of estrogen and calcium can help treat this disease. Other eating disorders include progorexia and infantile anorexia. Pregorexia is a fairly new term dated back to 2008. It describes pregnant women who try to control the weight gain during pregnancy by reducing their caloric intake and exercising excessively. Physicians are being encouraged to discuss appropriate weight gain with patients who are pregnant or trying to become pregnant. Infantile anorexia is a feeding disorder among infants. Symptoms include refusing food, lack of appetite, and growth deficiency. Eating disorders can be prevented in many ways. A few tips include celebrating and promoting the diversity of body shapes and sizes, focusing more on personal qualities rather than physical appearances, and discouraging unhealthy eating habits.